Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi.
Today we will discuss on a special topic on management of pain in animals with our expert Dr. Deepa Katyal, who is a leading veterinarian practitioner in Mumbai. Her international exposure includes working with the legendary Australian wildlife expert and conservationist Steve Irwin. In the course of her 2-decade career, she has been involved with many animals' welfare and animal rights organizations in various capacities. Her selfless work towards treatment of stray animals and fostering accident and trauma cases, both wild and domestic animals, is well known. She is also one of the very few veterinarians management in animals. After completing NAVC Institute Pain Management Program, she practiced pain management using acupuncture needle stents and cold laser warding the pain of many animals effectively, and the results were satisfying. She has certified herself in acupuncture in a masterclass from Cura Core Academy, US. She has been practicing acupuncture now for more than a decade. She is the only vet from India to give a TED Talk on pain-related issues. She is one of the very few veterinarians offering physiotherapy and rehabilitation service in her city. She reintroduced the concept of wheel carts and mobility harnesses, which improves the lives of paralyzed patients as well as their human companions. She plans to get more deeply involved in the subject and be able to help more immobile animals get back on their feet, or at least be free of pain and have a better quality of life. She is an ex-board of directors for the International Veterinary Academy of Pain Management, USA. Her association with various voluntary organizations such as PETA, RAW, TSPCA, including several other such organizations, spans over a decade and a half. Hello doctor, welcome to a podcast for patients, caregivers and healthcare professionals at Medica Talks. Hello doctor, what could be physical therapy and hydrotherapy mentioned by you?
So, treatment of diseases by physical methods such as medical massages, heat treatment, exercises rather than drugs or surgery is primarily what is physical therapy. So, there are different types of massages that are that come into this category for enhancing muscle strength. Basically, the strengthening of the muscles, especially in case of animals, because they cannot exercise on their own. Like, for example, when you go to a physical therapist in humans, she will ask you to raise your hand if she knows that this muscle is affected and she needs you to develop those muscles. But unfortunately, in the animal world, we cannot ask the animal to oblige or to listen to us. So we have different kinds of gadgets that we use to enhance muscles. That could include certain balls, medical massage balls, or they could be, the Fitbit bone or a balancing board that are available. And you have to basically train these animals or lure these animals into doing those exercises either by help of food. Hydrotherapy is the use of exercise in a pool. Any method that uses water to treat a variety of symptoms throughout your body is hydrotherapy. It's used for musculoskeletal conditions such as loss of muscles, again due to arthritis, joint stiffnesses, and even neurological conditions which can cause muscle degeneration. Hydrotherapy has to be assisted by an expert, especially in older animals or animals with heart problems. So since it's also a part of cardiovascular exercise, and once the animal is into the water therapy, especially in case of animals, a guided technician or expert goes along with the pet into the equipment and helps the animal move in synchronization with the moving water.
Additionally, you have mentioned about wheelchair and braces. How do they help in improving the life of the pets?
The wheelchairs are very poorly understood by a lot of individuals here, even pet owners, because they feel that a wheelchair is the best solution for a paralyzed patient. But here I'd like to clarify a point that one is that all wheelchairs do is more than give mobility to an animal, because an animal once on a wheelchair cannot sit and sleep in it. It can only be mobile for a walk, say, because you cannot allow a dog to be on a wheelchair 24 hours of the day. That's not how it works. So the understanding of people of a wheelchair is, oh, my dog now is, everything is sorted if the dog is paralyzed and it has a wheelchair. So basically what I'm trying to get at is, especially for larger dogs that are paralyzed or paraplegic or having issues with mobility, these wheelchairs, along with giving them mobility for a walk, it also improves mentation. Like all humans, animals also get very disturbed when they cannot walk. So as far as braces are concerned, different braces are used for different issues. Generally, they are used to provide stability to a joint and to avoid range of motion beyond a certain point. Or actually, not at all, depending on what the underlying situation could be. Just to cite an example, we use knee braces in dogs to restrict the range of motion in case the dog has some kind of stifle issue.
How does acupuncture help dogs or cats for relieving pain, and in what conditions can it be used?
So, to be able to understand how acupuncture actually works, we need to understand a couple of things before that. We all know that the minute we say acupuncture, we think about needles being inserted on an individual or an animal or whatever. And we should also know that this is a part of traditional Chinese medicine that has evolved and was existing almost 3,000 years ago. Now, through the years, there are changes in how acupuncture is done and the theory behind acupuncture. But we must understand that there are existing 361 points and 13 meridians on which the concept of acupuncture actually dwells on. So basically, if the acupuncturist is well aware of the origin of the nerve and the blood vessel in a particular area, that point will be providing more efficacy, because we know that if there is a blood vessel surrounding any nerve, it is definitely more rich in oxygen supply, and therefore the efficacy of the point definitely changes if the track you select for a particular element is close to a blood vessel or it is the origin of a particular nerve. Also, these points have their roots in ancient times before modern methods were available, and it is backed up with a lot of studies indicating how acupuncture point really works and what is the physics and mechanisms which are involved in its action. The use of functional MRI or fMRI also showed that how acupuncture is effective by stimulation of certain points, and the method and the duration of stimulation that is used. So the stimulation of acupuncture needle, what does it actually do? It causes nerve stimulation, it enhances blood circulation, it relieves muscle spasm, and all this causes release of happy hormones, like we can call them, such as endorphins, the serotonins, which are basically body pain control chemicals. Also, cortisol, which is like a natural steroid and brings about sense of well-being and a feel-good feeling in an individual. The National Institute of Health developed a consensus statement about acupuncture and about how its efficacy is. And it's also stated that there is a compelling evidence that acupuncture is used for management of osteoarthritis and musculoskeletal diseases. I mean, there is a lot of scientific backup and a lot of papers that are available on this related topic, and how it is supposed to be one of the most effective therapies for pain management, which is without using medicines. I would also at this point want to reiterate the actual definition of acupuncture, which is available in certain journals. It goes as that acupuncture is a therapeutic modality which involves insertion of fine needles. It is an adaptation of Chinese acupuncture here I'm emphasizing on this point, using current knowledge of anatomy, physiology, pathology, and the principles of evidence-based medicine. This here is extremely important. So while Western medical acupuncture has actually evolved from Chinese acupuncture, its practitioners actually no longer adhere to the concepts of yin-yang or circulation of Qi, and regard acupuncture as a part of conventional medicine rather than a complete alternative medical system. So you see how it is important for us to understand that acupuncture has a lot of science basis to it, and the therapeutic efficacy that it provides is also evidence-based. It also further adds that it acts mainly by stimulating the nervous system, and that its known mode of action include local antidromal, axon reflexes, segmental and extrasegmental neuromodulation, and definitely other central nervous system effects. It also further adds that it acts mainly by stimulating the nervous system, and that its known mode of action include local antidromal, axon reflexes, segmental and extrasegmental neuromodulation, and definitely other central nervous system effects. Now, we must also understand that Western medical acupuncture is principally used by conventional health practitioners, most commonly, obviously, for primary health care. It is also mainly acupuncture is used to treat musculoskeletal pain, here including myofascial trigger point pathology. It is also effective for post-operative pain and nausea. The practitioners of Western medical acupuncture also tend to pay less attention than classic acupuncturists in choosing one point over the other, though they generally choose classic points as the best place to stimulate the nervous system. So also the design and the interpretation of clinical studies is perhaps constrained by the lack of knowledge of the appropriate doses of acupuncture that are used. And also there is a likelihood that any form of needling that is used as a usual control procedure in placebo-controlled studies may be active. So finally, we eventually arrived to the conclusion that Western medical acupuncture justified an unbiased evaluation of its role in modern healthcare service. And lastly, to summarize it, the conditions that acupuncture is indicated for or used for. So acupuncture is indicated or used for functional problems, a variety of functional problems actually, such as those involving paralysis. I see a lot of paraplegic patients or quadriplegic patients in my practice, which come to me for seeking help and guidance as to how we can neuromodulate these animals and make them walk again. And primarily also for pain relief, especially in those cases which cannot take medicines, like, for example, a kidney patient maybe who cannot take too many drugs, or a dog with jaundice having other kind of underlying ailments and too much pain, puppies which cannot be taking too much medicines, non-infectious inflammations such as allergies and pains. Small animals, there are some of the general conditions which may be treated with acupuncture most likely. Musculoskeletal problems, including arthritis, intervertebral disc disease, traumatic nerve injuries, which are very, very common, and we see a lot of these kind of cases. Respiratory problems such as feline asthma can easily be also treated with including arthritis, intervertebral disc disease, traumatic nerve injuries, which are very, very common, and we see a lot of these kind of cases. Respiratory problems such as feline asthma can easily be also treated with acupuncture. Skin problems such as Lake granuloma, allergic dermatitis, gastrointestinal problems such as diarrhea, even constipation, reproductive problems. Like there are a lot of number of problems that can be actually treated with that. Most commonly, we see cases of mobility and incontinence in cats, allergic cases, or maybe atopic cases, which are not getting treated by medicine, which people will need to use steroids and other kind of long-term medication when a lot of patients are not happy using that. So we used about acupuncture for most of these kind of ailments, and it is a very, very result-based treatment, and most of our patients get a lot of pain relief with these therapies. I in person also use a lot of acupuncture in my trauma cases. I treat exotics, so we have a lot of monkeys that have fall injuries or epilepsy because of head injuries, damage to brain. And since we have financial restrictions in meeting medical management for these kind of cases, I use a lot of acupuncture in these primates, and the results are just very astonishing and unbelievable, because we have a complete remission of pain, and even for seizures, like I found that this therapy is incredibly rewarding, especially when you compare it to the medicines that are given to seizure patients, can create addiction and drowsiness and lead to other problems because of the dogs slowing down, generally circulatory system issues that come with anti-epileptic drugs, constipation that can occur with these kind of drugs because the animals' lifestyle changes, they slow down, they stop going for walks. And as compared to when you start acupuncture, we see like incredible changes in the demeanor and the behavior of these animals, and very gradually with the number of sessions and time and what kind of therapies and needle insertions are happening at what points, basically cranial points when you find that this treatment for epilepsy or anxiety is extremely rewarding in our cat. We see like incredible changes in the demeanor and the behavior of these animals, and very gradually with the number of sessions and time and what kind of therapies and needle insertions are happening at what points, basically cranial points when you find that this treatment for epilepsy or anxiety is extremely rewarding in our cats and dog patient, and even a lot of primates that I take care of. So overall, I think this is a very, very rewarding field, and it should be more accepted by people and understood by our city people, because it's a very, very rewarding therapy.
Dr. Deepa, what message would you like to give to our listeners?
Yes, the message that I would like to probably give through this podcast would be that just like we humans want to be pain free and not suffer chronic pain, etc., I think all living beings, which includes plants and animals, should also have the right in our space to have the same kind of comfort and be pain free, which actually would need the pet owners and caregivers to the animal industry or animals in general to first take a step in understanding how your animals express pain, because it becomes extremely important. Unless we recognize pain in animals, or unless we recognize how these animals express pain, we may not be able to help them. So I think it's very important for us to start noticing these things in our space. And the other thing is, I work with wildlife and I work with a lot of primates. And very often in our city, we have these primates getting burnt, electrocuted because of high voltage, and they suffer very fatal wounds. Secondly, also most of these primates, they fall down from trees, from building rooftops because of the way their houses or the forest that they are staying in are getting encroached upon. The biggest message over here, which is not related to this podcast, but it is related on humane grounds, is that somewhere, if anybody with the right authority is hearing this, please consider the fact that the forest belongs to these animals and we should preserve and conserve them. Otherwise, each and every one of us is going to get into trouble sooner or later. And the universe will give us certain hints which we've already got in the past year with the corona hitting us. But I think we've still not learned our lessons. And I think that we human beings really need to be very mindful that we need to share our space in very humanely with these animals, and we have to give them the best what nature has provided us with.
Thank you, listeners.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.